Another complication that arises from pulmonary hypertension is right-sided heart failure. So again, pulmonary hypertension puts a chronic pressure load on the right heart, and this pressure load can lead to right ventricular failure. The clinical recognition of right-sided heart failure is often the clinical signs the patients are showing, as well as ultrasound of the heart to show right-sided dysfunction. And the clinical signs that you may see are jugular distension, which is evidence of elevated right-sided pressures, pulsation from tricuspid insufficiency, or an arrhythmia. Patients may have evidence of cavitary effusions, so ascites and a distended abdomen, or weight gain, or if they have pleural effusion, they may have shortness of breath. So treatment of right-sided heart failure involves mechanical removal of the effusions, so centesis, whether it's abdominocentesis or pleurocentesis, and then diuretic therapy to keep those effusions from recurring. And usually the diuretic therapy involves furosemide. Another newer loop diuretic is torsemide, which has a longer duration of action, so you may choose torsemide in lieu of furosemide. Patients also need support of their pump, and so we use the inotrope pimobendan. And in addition, these patients usually have pulmonary hypertension causing their right failure, so part of the therapy is trying to offload the right heart by the use of sildenafil and that nice vasodilator to help decrease the pressure load. Last but not least would be drugs to try to blunt the activity of the renin-angiotensin-aldosterone system. So this is usually spironolactone with an ACE inhibitor. If pills are becoming too numerous and I had to just pick one, I would pick spironolactone. The prognosis for right-sided heart failure does again depend on the reversibility. So we're treating the pulmonary hypertension, which should have some degree of reversibility, and supporting this pump. So in general, the more chronic the heart failure, the less likely they will come off of diuretic therapy. But I've seen many cases where we treat their pulmonary hypertension, we stabilize their heart failure, we treat the animal with adulticide therapy, and they can ultimately be weaned off of medications and have a relatively good prognosis.